I'm doing it for you here on the radio. You can see that, I'm sure. You'll see the Adam's apple actually sitting right where it is. The part that moves, that was good, wasn't it? When I swallow is the thyroid, and it's right below the Adam's apple and just kind of right above the collar if you feel the bones down there.
Right.
If it's enlarged or asymmetric, meaning one side's bigger than the other, sometimes you can actually see that in the mirror. And if you do, it's certainly reasonable to bring that up with your doctor.
Then you have an issue. What is the thyroid's job?
So the thyroid is a little, I like to say butterfly-shaped organ because, I think of women, but you might think of it as an anvil-shaped organ for men. But in any case, it sits there and it's the master gland. It's one of the metabolism. It's one of the primary regulators of metabolism. So metabolism, of course, is what causes us to burn energy. So if we have a slow metabolism, and as we get older, inevitably it tends to slow, we tend to gain more weight, or we get more sluggish, fatigued, tired, need more sleep at night. Sometimes we find ourselves eating either less or more, depending on what the thyroid is doing. But the thyroid is a hormone, kind of like estrogen, progesterone, testosterone. We all have that, some of that, even us men. And the thyroid, the individual hormone, actually activates cells all throughout the body. So every part of the body, every cell in the body has thyroid hormone receptors. They are inevitably intertwined with metabolism and generalized health. Similarly, estrogen receptors are present in every cell in the body. And ironically, not surprisingly perhaps, estrogen and thyroid often work together and cause similar types of problems. So it confuses people sometimes as to what the diagnosis might be if you're having symptoms. Symptoms are pretty common. Let me tell you about them.
Okay, please.
So symptoms include fatigue and weakness. It's probably the number one symptom for women who have hypo or too little thyroid. And then sometimes excess energy, not able to sleep, losing weight but not trying. Well, that would be a good point, a good problem for many of us to have.
Right.
But those types of problems may reflect hyperthyroidism. Skin changes, hair changes can be affecting both women and men in hyper and hypothyroid, high or low thyroid. Appetites can change. Your menstrual periods can disappear, assuming you have menstrual periods. They can become quite irregular. You may bleed intermittently. You may not bleed at all. Sex drive can change. You may feel cold even though everybody else is feeling quite hot. It may change your bowel function. You may have aches and pains in your muscles, swelling, especially around the eyes. You can even lose hair, ironically, on the eyebrow. Somebody tells you, God, your eyebrows are getting smaller.
Really?
Yeah, the eyebrows from the outside in start to kind of disappear. Very interesting.
Gee, look, mine are doing that right now.
I'm worried about you.
I
No.
was waxed last week. It's okay.
Perfectly nice. Does that hurt?
Yes. Yeah, especially for a man. If you're not used to it, it's like, ow! You do this all the time?
Remind me just to not do that.
Yeah, don't do it.
Good stuff. So those are kind of the symptoms, and unfortunately, they are very similar to menopause. So when a woman hits menopause or perimenopause, that area, that time period, maybe 5 or 10 years even before the ultimate onset of menopause, which, by the way, is the last period a woman has, the symptoms of fatigue and hot flashes and hair changes and skin drying, those things are all very, very common in menopause as they are in thyroid disease. So it's always prudent to check the thyroid whenever those types of symptoms are coming up.
So what age should you start checking your thyroid?
Well, with symptoms, of course, have a low threshold, meaning any age. You can have thyroid disease as a baby. About 1 in 4,000 babies who are born have hypothyroidism. And that is a killer. I mean, it is a significantly negative experience to have too little thyroid disease, both in pregnancy as well as once you're born. In pregnancy, women are very commonly diagnosed with thyroid disease. It's an autoimmune disorder. Not to go into details, but a simple autoimmune disorder in a lot of people is diabetes. So you can think of it, if you have a risk of diabetes or you actually have diabetes, your risk of thyroid disease also increases fairly significantly. Not all thyroid disease is caused by this autoimmune disorder. And just to be clear, an autoimmune disorder
Makes me think of AIDS.
You know, it is a very similar process in where the body attacks otherwise normal cells. So it starts to perceive the body's immune system, which also activates mostly in the same area where the thyroid is, but from different cells. It seems to recognize thyroid, the actual cells of the thyroid gland, as irregular or unusual or abnormal cells. And they're not necessarily in any way, but that process, the inappropriate recognition of them, leads to this fighting them and killing those cells. And of course, if they die, kind of like the cells of the pancreas where insulin is made for diabetes,
Right.
if it kills those cells, then of course you have less and less of the hormone being produced and thus more likelihood of becoming hypothyroid. So all of that being said, the pregnancy women who are pregnant can often have this diagnosed. What are the problems of pregnancy? Well, they're fatigue and sometimes hair changes and just feeling otherwise not comfortable with oneself. And of course, you're gaining weight many times.
Right.
All of those things are also the side effects and the symptoms that we'll experience with thyroid disease. So it's something that you need to have another low threshold for, particularly in pregnancy, because if it is present, not only do you suffer, but the baby can suffer, and it can suffer permanently. There can be significant mental retardation and other challenges that may occur if babies don't have enough thyroid given to them essentially through the process of their mothers initially and then over time as they develop. So that's a key piece as well. The most common time, however, is as we get older. Perimenopause, around 45 to 50, the average age of menopause.
That's when it hits.
Yeah, in general, that's the more common time. But as you get older, there's more of a risk. And about 1 in 8 people in this country, 1 in 8 will actually have hypothyroidism, either subclinical or clinical. What does that mean? Well, subclinical means, if I checked your blood and tested you, it just wouldn't look like you had the disease. And this is a huge issue because historically, people would give thyroid medicine. It was actually made, and still is, a company called Armour, like Armour Bacon. They, from pork, make thyroid. And it's
Really?
It's one of the quote-unquote natural approaches for thyroid replacement. There are many other drugs on the market, for example, that are FDA approved, like Synthroid, which is the most commonly prescribed medication for thyroid disease. But they're different. And the interesting part is if you replace the thyroid, most of the symptoms will get better, but not all of them. One interesting symptom that's true of pregnancy, perimenopause, and older age is depression. Depression is a very common problem, individual and independent of thyroid, but they seem to coexist very frequently. If you don't have enough thyroid, it seems to affect the brain and the brain's function of norepinephrine, serotonin, dopamine. These are hormones. Happy things, right. These are hormones that people probably have heard about out there at some levels. And they, like you said, they're the happy drugs. If you don't have enough of them, we throw more medicines at you to try to get more of them. The Prozacs of the world, the Zolofts of the world. These medicines cause you to have more serotonin. Well, if you have too little thyroid, you will also end up having too little serotonin. And there's an interesting relationship. If you do, however, treat the thyroid disease, noting that, in fact, you have that diagnosis, it may not be enough to treat the depression. It may reside inside and need other treatments, not only for the depression, but also for just general well-being, general concepts of feeling good about yourself. Even therapy and thyroid disease go together, although that's uncommonly discussed.
Right. Well, is there anything we can do to take care of our thyroid before we get to this?
Well, there's a problem called iodine deficiency. One of the things that happened around the war, World War II, I believe, was the idea that salt could be supplemented with iodine. Naturally, if you get salt from the ocean, you're going to typically have iodine in it. And so that process was great. But there were ways that salt was being produced and other foods were being produced that were leaving a lack of iodine in the diet. Women, again, more frequently than men are affected by an iodine deficiency. When they have that, their hormones, their thyroid is struggling to make enough thyroid hormone. It requires iodine to be able to function, to be able to put it together. And if you don't have enough, obviously it's not going to produce enough. So at the end of the day, just a simple iodine supplement or eating foods rich in iodine like kale and spinach and some of these greens that we always say are good for us, and I'm sure they are.
They are, well, absolutely.
Kale's the perfect food out there, by the way.
And it's yummy.
It is.
It's like Swiss chard is the same family. I like Swiss chard.
I like it. Greens, Chinese greens, fantastic foods for you. Not too much oil, though. Yeah, in any case, so supplementation is one of the things that can help us just in a quality, healthy diet. Making sure that your hormones are balanced. There's a whole nother discussion in future radio shows and others about hormone replacement and menopause management that has to do with estrogen, progesterone, testosterone, and replacing those as they wane in us as humans, both men and women as well. Obviously, it affects women quite a bit more. It's talked about quite a bit more.
Right.
But at the end of the day, making sure that those hormones are balanced in a woman is another part of the process of maintaining thyroid health. Just really checking the thyroid on a screening basis. So a woman goes in to get a pap smear. They used to do it every year, and those of you who are doing it every year, check in with your doctor, because that's really not the requirements for pap smears. I realize we're not talking about that today. Yet another
That's
show.
okay.
But actually nowadays we do pap smears every 3 years. But the reality is, as you do that, check in and say, hey, what other tests do I need? You know, we need other screening tests like bone densities when we turn not menopausal, unless we have lots of risks, but at 65 years old and older. We need screening for colon cancer, which starts at 50, unless you have a family history. We also need screening for thyroid disease. And there's a couple schools of thought. Most of us look at the idea of screening thyroid disease every 5 years, starting at either 40 or 50. Kind of depends on who you read, what have you. I tend to screen at 40, but I have a very
Better safe than sorry.
I think so. I mean, it's a single test. I don't tend to order more than is necessary, but it's a single blood test once every 5 years, and there's other tests that are important to throw in there. Looking for diabetes, for example, just
Right.
checking glucose is another screening test that we would want to do. Bottom line is, we do a lot of tests. Sometimes we do too many. But the idea of screening for thyroid disease in order to catch it when it's early is extremely valuable for women and as well as men.
So that's what we've learned is we need to start screening between 40 and 50, but you should ask your doctor, your personal.
Sounds like a great plan.
Somewhere between. Will you come back again? Because I think we could
I
talk
love it.
about a lot of things.
I would love to be. I used to do a show here about 5 years ago for a couple years, once a month, and I had a great time with it.
It shows.
Oh, thanks.
You just were like, sure, let's go.
Let's make it happen.
Where's my headphones? Let's go.
Let's make it happen, yeah.
Well, Dr. Kirk, I appreciate you coming in this morning.
Thank you so much.
I think we've learned something, and I've learned that doctors come to the radio station before they go to work to do surgeries.
Somebody's got to do it.
What are you doing this morning?
You know, we got a couple things going on. Nice C-section going on, bringing a new baby into the world.
Oh, that's awesome.
Yeah, we've got some things that don't need to be in that need to be taken out. So we'll take some of those things out. And
How does that make your day when you know you're getting up and you're going to bring a new human in the world?
It's a pretty amazing process, you know.
What a neat way to start your day and your new
It's a
year.
blessing. It's a true blessing.
It is a blessing. You're going to bring a new human in.
Yeah, exactly right. Exactly right.
Well, congratulations and thanks so much.
Thank you, Bob. I really appreciate it. Love your smile too. This guy is great. There's no question. He really needs to maybe have a TV show aside from the radio show so we can really see the personality, because this
Creepy
man has a
Coffee
great
movie
gift.
time every
I like
Saturday
that,
night,
too.
11 o'clock.
Perfect. Well, there it is.
Coffee TV 20.
I love it.
There you go.
Thank you so much, Bob.
Oh,
I
thank
appreciate
you,
it.
Dr. Kirk. We'll have Dr. Kirk back again. We're going to talk about something with women next time he comes in, because he seems to be quite in the know. And he's going to deliver a baby today.
Love it.
What a beautiful thing. Thanks again. Now it's time to check in the newsroom.